They also had diseases that we know about today, such as smallpox, which back then would do small incursions. It wasn't like a big epidemic during the Middle Ages, but a 9th century priest first noticed that it had different symptoms than some of the other rashes they saw, and started to actually make notes about, well, this disease looks different than this, as opposed to other people that just thought, you have itchy bumps, it's this sin, go away. And he wrote a book called The Book of Smallpox and Measles, which tried to keep them separate. And they tried different remedies, such as cold air and herbs, and some people got better and some people didn't, so they really had no idea about who they actually helped and why it helped or anything. The Chinese during the Middle Ages knew that if you were around people with smallpox, you were then immune to smallpox. So people would purposely buy clothes that someone with smallpox had worn to wear it. Or they'd sleep next to someone with smallpox and try and give themselves a mild case of smallpox so they could get it over with and not have it later on in life. So they knew that, but there wasn't that much communication between the different sides of that continent.
Sounds fun.
Yeah. But they were on the right path, at least. And then measles, it actually came from dog distemper. That's how it originated. There was a lot of dogs in the Middle Ages. People used them for hunting, and they always had lots of them. They were kept in the building to help keep people warm. They slept on their beds. They chased away rats and cats and weasels and stuff like that. And symptoms started cold-like, so they didn't know what it was at first, and that's how it became much more of a problem. And then they'd get the red itchy rash. So they figured that because it was red, the rash was red as opposed to smallpox, it must be too much blood. So that goes back to what the Greek had learned about the bloodletting. So they would try bloodletting to get rid of some of the blood. That was your problem. And then they'd actually use wolf skin, which made them stop itching, they thought. So they would rub themselves in wolf skin. Complications caused blindness and brain damage, which was actually a bigger problem because after that you had problems in life. You couldn't work, you couldn't provide for your family or anything. So they'd take people that were mentally impaired and just tie them up to the pews in church and hope people would give them enough donations to live. And they had shelter at the church, and people would bring them bread and stuff because they felt bad for them.
Wow.
Then we get into some more serious diseases. Leprosy was a big problem. It was spread through respiration from people that were infected, but it has a really long latency period. Sometimes you could carry it for a year before you start seeing signs. So there was no way of telling who you were around. They had the right idea as far as you're a leper, you have to go to a leper colony, but by the time you saw signs, you had been near 400 other people in that year, so all those people are going to get it. It would cause the skin spots, which become insensitive at first, and then gangrene and stuff would set in from wounds. So they would do what's called visual surveillance exercises, where like every 5 minutes they had to stop and look at themselves and make sure they didn't have any wounds they didn't know about, because that's when gangrene sets in and then they're going to die. The monks, which were forbidden to treat people, decided that they should set up leprosariums, which were sanctuary houses for the lepers. And they would quarantine them and pray for them and try and keep them from getting gangrene, pretty much, just treat them symptomatically. And that was their sort of making themselves feel better for the church, saying you're not allowed to treat people. Well, we're not really treating them, we're just giving them a life as opposed to shunning them outside.
Well, Japan, surprisingly, outside of Okinawa, there's an island, and it was a leper colony to start off with. That's where Japanese would send all their leper people. And you can still take trips there to see the old leper colony.
Really?
Yeah.
They did what was called separatum leprosum, which was ritualized separation from the community. If you were diagnosed a leper by a physician or a medicine man or a monk, then you had to leave life, pretty much. You were dead to the world. They would give you a few days to prepare, which means you have a few days of walking amongst people, still spreading leprosy, and then they would take you outside of the church, and they would dig a grave for you, and you had to climb in yourself, and then they would throw dirt on top of you and hold a funeral. And all your family and stuff would come and watch you be buried. And the priest would say that you were dead to the world, holy God.